Hello, ladies and gentlemen, and thank you so much for listening to another section of Brain Talk. And this time we'll talk about, the internal structure and approaches to the brainstem. Here, this lecture, the pictures is coming from the Roton book of neurosurgery approach. So today we are going to talk about the internal structure of the brainstem, as well as the safe entry zone surgical approaches of the brainstem. So the brainstem is divided, to the midbrain, pons, and medulla. This is here the picture. As you see here is the midbrain, here is the pons, and here is the medulla. Between the midbrain and the pons, this called pontine mesencephalic sulcus, and between the pons and the medulla there is called medulla pontine sulcus. Here is the midbrain, and here is the pons, and here is the medulla. In internal structure of the brainstem, starting from what's called the medial lemniscus, which is related to the proprioception and vibration of sense. As we see here in this picture, the medial lemniscus is starting from the cuneate nucleus and gracile nucleus here in the medulla, and after that crossing to other side and coming up to the inside the brainstem and going to in the thalamus and reaching the cortex of the brain. So it's traveling through the brainstem and divided to can be divided to dorsal and ventral parts. The medial lemniscus is the most tolerant fiber for surgical manipulation in the brainstem. Here is it can be divided. Here is the medial lemniscus. Here we divide this according to our approaches to what's called ventral and dorsal. Ventral here and dorsal here. The corticospinal tract is actually can seen in the whole brainstem. As we see here in this picture, here's the corticospinal tract. It's coming from the whole brainstem to the spinal cord, and in front of the medial lemniscus here is called the ventral brainstem. The ventral part of the midbrain and pons contain what's called firstly corticospinal tracts and corticobulbar tracts, and lastly corticopontine tracts. Here is the corticospinal tracts, which is coming from the upper part of the cortex and coming to the what's called the basal ganglia. After that, reaching the brainstem, and it's dissociating in the middle there. Here is the corticospinal tracts, as we see here in this picture. As we see here is the cortex, and after that's coming to internal capsule in the basal ganglia here, and it's coming or going down to the medulla, where they decussation in the pyramid here, and after that going to the spinal cord. And here is the corticobulbar tracts, as we see in this picture here. And the corticobulbar, or called corticonuclear tract, is two neurons white matter pathway connecting the motor cortex in the cerebral cortex to the medullary pyramid. But only they didn't go down to the spinal cord. The corticobulbar tract is composed of upper motor neurons of the cranial nerves. So the muscles of the face, head, and neck are controlled by the corticobulbar system, which terminate on motor neurons within the brainstem motor nuclei. Here is the corticobulbar tracts, as we see here, it's coming from cortex and stopped in the in the medulla, in the last station for the corticobulbar fibers. And here is lastly the corticopontine tracts, as you see in the medial side, in the midline, from the midline, and the corticopontine fibers consists of or can be divided to the I'm sorry, here is corticopontine tract fibers. It's coming from the cortex of the pons only, and is divided to the frontopontine and parietal-pontine and temporopontine and occipitopontine tracts. And the function is communicate with the opposite cerebellum to allow to coordination of the planned motor function. So this is the caudal medulla. It only contains only the corticospinal tracts only, not the others two tracts. And in the midbrain, the corticospinal tracts and the corticobulbar tracts are located in the mid portion of the palm of the cerebral peduncle here. And in the pons, the corticospinal tracts travel from anterior to the medial side of the pons here, from anterior to medial, anterior medially. And here we are looking from behind the brainstem, and we behind the medial lemniscus is called the dorsal brainstem, and in front it's called the ventral brainstem. This is very important when decide for our plan for operation in this area. So we have now another structure is very important. It's called the medial longitudinal fasciculus, extend from the midbrain to the upper spinal cord next to the midline. So annulation in the MLF, or it's called medial longitudinal fasciculus, can produce what's called internuclear ophthalmoplegia, which is called vertical gaze palsy. As we see here, here is the medial longitudinal fasciculus. The medial longitudinal fasciculus, it interconnects the nucleus of the oculomotor nucleus to the trochlear and abscess nerve nuclei, to coordinate ocular movement. Here is called the central tegmental tract in the brainstem. The central, the tegmental tract, connects the inferior olivary nucleus to the red nucleus by passing through the facial, the facial colliculus. Here is the facial colliculus, as we see here. Here is the olivary nucleus here. Here is the red nucleus, and here is the central tegmental tract. The trigeminal nerve, give off two tracts, which are, it's called ascending trigeminal mesencephalic tract and descending trigeminal spinal tract. So damage to this, trigeminal tracts may cause some loss of sensation after operation. So here is the trigeminal nerve here. And it's give off the firstly is called ascending trigeminal mesencephalic tract, and here is descending trigeminal spinal tract. The MLF is called medial longitudinal fasciculus. It travels next to the midline. This is, as we see here, is from the posterior side, posterior of the brainstem. And the central tegmental tract is part of called extrapyramidal system. So damage to this, tract can cause intention tumor or skull nystagmus. The central tegmental and trigeminal, mesencephalic tracts, position between the superior peduncle laterally and the sulcus limitans medially. Here is the superior cerebral peduncle in both side laterally, and here is the sulcus limitans. So we are now coming to the most important lecture here, or the most important thing we want to discuss here in this our lecture is the brainstem safe entry zone. So we'll divide our our safe entry zone to the midbrain firstly, safe entry zone, and we have also the pons. After that, the medulla safe entry zone. So we'll start firstly by the midbrain safe entry zone. Firstly, the first area here is called the perioculomotor safe entry zone. So it's used here, this area for, this is the oculomotor nerve, and we use this area for ventral midbrain lesions like cavanoma. So the perioculomotor zone is the most safest area to reach this lesion in this side, or on the ventral side of the brainstem. So the perioculomotor zone is actually bordered by the posterior cerebral artery superiorly and the superior cerebral artery inferiorly. So here is our entry zone for safe resection of lesions in the brainstem. Actually, we use the Transylvian route by nocturnal or orbitozygomatic approach can be used to reach the safe entry zone. Here is the right ancus here. I'm sorry, the left ancus here. Here is the oculomotor nerve here, can be seen, and here is the in the side is called the basilar artery, and here is the posterior clonate process, which sometimes can be drilled to see more clearly for this approach. Here is the perioculomotor area, as we want to enter our safe entry zone, and is directed through the frontopontine fibers here, and bordered medially by, firstly, the oculomotor nerve here in medial side, and laterally by the medial edge of the corticospinal tract. If we removed the frontopontine fibers, so we can expose the medial lemniscus, which is actually divide the brainstem to the ventral and dorsal midbrain. Here is the corticospinal tract, is the lateral limit of this our exposure, and we must be very careful when we do our operation in this area, because if you go so more laterally, you will injure the corticospinal tracts, make us patient to have hemiplegia. And here is the entry zone through the perioculometer area. So we can reach, the ventral midbrain here, and also we can reach into behind, the lemniscus, is called the dorsal of the brainstem. So here is the medial lemniscus here. So our, this trajectory can reach to the ventral or dorsal of the midbrain. So any damage, to the intermesencephalic, segment of the oculomotor nerve here can cause, a deficit in the oculomotor nerve. So we must be very careful when doing our, dissection for lesion, or our, enter into this safe area. The segment, of the mesencephalic oculomotor is arise from the oculomotor nucleus here and pass medially and inside the red nucleus to exit, the midbrain through the interpeduncular fossa. So thank you so much for listening for the first section of the safe entry zone of the midbrain, especially of the it's called perioculomotor safe entry zone. See you in next lecture for continuation of our safe entry zone of the brainstem. Thank you so much.